Hello, and welcome to today's webinar, PUSH Collagen Dipeptide, a wound healing supplementation. This webinar is part of the Wound Source Wound Care Product Navigator series. The Wound Care Product Navigator series is an easy-to-access, interactive learning lab for healthcare professionals to get the latest information they need on the wound care products available to them. Each webinar segment will take a deep dive into a specific product technology. Our sponsor for this installment is Global Health Products. My name is Emmy McCauley from Wound Source, and I will be the moderator for this event. This program will provide an in-depth look into Global Health Products' collagen dipeptide nutrition supplement, providing information on the benefits of introducing a collagen dipeptide supplement to your chronic wound plan of care, as well as a closer look at the science behind PUSH Collagen Dipeptide. This presentation will be followed by a question and answer session, so we encourage you to submit your questions to us throughout the program. As a reminder, the content of today's webinar is for informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment, nor is it intended to be a substitute for manufacturer instruction. As always, refer to your facility protocol in the assessment and treatment of patients. The views and opinions expressed in this program are solely those of the presenters and do not represent the views of Wound Source, Kestrel Health Information, Inc., affiliates, or subsidiary companies. Now I want to take a moment and provide you with an overview of your webinar console. At the bottom of your console are application tools that you can use during the webinar. To submit a question to our guest speakers, please select the Q&A app icon on your screen and type your question in the field provided and select Submit. We will try to get to all of your questions during the question and answer period. You can expand your slide area by clicking on the Maximize icon on the top right of the slide area or by dragging the bottom right corner of the slide area. If you have any technical difficulty during the program, please click on the Help icon, which is the app with the question mark. This covers the most common technical issues. To access information about today's guest speakers, you may select and expand the Bio app found on the left-hand side of your console. Our sponsor has included additional information on today's product. On the right of your console, you will find a list of resources available for download. You may also access this information by selecting the document icon in the bottom tray of your console. This webinar is being recorded and will be made available on demand. If you have any other requests or questions pertaining to this program, please contact our sponsor using the Contact Us app located in the tray of your console, which is the application with the email icon. Now, before I introduce today's guest, please take a moment to complete our quick poll, which should display on your screen here momentarily, to help us find out how many have joined us for today's session. The question is, how many people, in addition to yourself, are watching the webinar with you today? If you are attending this webinar by yourself, simply enter a numerical 0. If you are in an in-service setting, an estimate is fine, and we thank you for your response. At this point, I want to welcome our featured speakers, Al Soyura and Blaine Hicks. Al is the founder and president of Global Health Products and has over 35 years of experience in the nutritional supplement industry. Al works closely with healthcare professionals to create supplements that satisfy the needs of patients. Blaine works in research and development, where he has over 12 years of experience in food and nutrition. He has spent the last 5 years focusing on bioactive proteins. Al and Blaine, thank you so much for joining us today. Al's going to get us started.
Very good. Thank you, Emmy. And good afternoon, everyone. My name is Al Soyura. I'm the president of Global Health Products. We are based out of Rochester, New York, and have been developing and manufacturing nutritional supplements for the healthcare marketplace since 1999. Today, we have a new, exciting wound care supplement that we would like to share with you, and it's called PUSH. PUSH stands for Pressure Ulcer Supplement for Healing. Today, I am also joined by Blaine Hicks, the Research and Development Director from the company that holds worldwide patents on this special collagen dipeptide. Blaine will discuss the actual science behind this dipeptide and its functionality after being consumed within the body. I would first like to share with you how I personally became interested in this particular collagen ingredient. I was invited by the Asian company who produces this particular product to their Carolina location. They brought in their scientists and researchers from Asia. I went to this program and this presentation, and I looked back at the notes that I wrote, and I came up with these 5 elements that I thought were very important. First of all, the company was over 100 years old and had extensive clinical studies on skin, joints, and muscle, key to the medical marketplace in which I called on. They claimed that the product would add 50 to 70% more moisture to your skin in 4 to 6 weeks. Great for my customer base of geriatric patients. Bioavailability was proven, was tested, and found in human plasma for up to 4 hours. They discussed a new patented short-strand construction of key dipeptides, the key for absorption and positive outcomes. They also discussed that you only needed a small amount of powder to consume to see positive outcomes. Perfect for my geriatric population who do not drink large volumes of liquid. So I was very excited to get this information, but I was an excited skeptic. I'm one of those people where you need to show me, you need to prove it. So I went back home into my own community. I also own a company in Rochester, a DME Part B company that services 65 nursing homes for wound care. I've been in business for 35 years. For years, I've walked the floors within my nursing homes and seen the onion-like skin that so many of the seniors have developed. I've watched my nurses with the most difficult of patients, with stage 2, 3, 4s, patients with no locomotion, people that didn't eat well, people that were incontinent. Most of our wounds were in our sacrum and coccyx area. So I had seen for the last 35 years the most difficult wounds in our community. So now I had an opportunity or another product to put into their tool chest that maybe could help them. Could this product help by increasing moisture in their skin? Could we make the skin more resilient to damage by adding more moisture? Wound care treatments, I know, are based on keeping wound beds moist to increase granulation and healing. By adding internal moistures, could I heal the wounds from inside out? I had all these questions dangling in my head, and I really wanted to find out if what they told me would work. So I have a very unique situation here in Rochester because in my wound care practice, in my 65 nursing homes, Liberty Health, my other company, provides the medical teams within the nursing homes with an internet-based assessment software that allows them to document their weekly skin rounds and order their dressing treatments. So I have historical data for over 7 years on heal time on thousands of wound beds. I was going to use my historical data to compare heal times before PUSH and now with PUSH to see if it had any effects on heal times. So my next step was to meet with my geriatric team to share them the clinical results and provide the scientific information that I had received from the presentation in Carolinas. The next step was to agree to a trial on the collagen dipeptide. Since the collagen dipeptide is recognized as GRAS, generally recognized as safe by the FDA, and has no contraindications, we had nothing to lose and everything to gain. So I mixed in my plant the concentrated collagen with a very, very light pineapple flavor, and we began our study. We began our study in a 160-bed SNF facility. Our software showed that we had 53 various types of wounds. It was your normal buffet of wound types you would find in a nursing home. We had stage 2s, 3s, 4s, surgical sites in a TCU unit, unstageable wounds, and diabetic ulcers. Nursing distributed the PUSH from their med carts. Patients were given PUSH twice daily and 3 ounces of water. Week by week, documentation and assessments were done. By the second week, we began to see improvement on most wounds. By week 4, we're closing at a rapid rate. As I made my daily rounds or weekly rounds into the facilities to see how things were going, I knew that I had a winner of a product when my nurses were chasing me down the hallway, grabbing me, telling me, you won't believe what we're seeing when we took this particular product. Heal days began to drop by 50%. In 6 weeks, we only had 8 wounds that remained open out of the 53. 6 out of the 8 that were remaining were closed in another 4 weeks. We were able to take heal times average from 90 days to 30 days. Administration of the facility recognized the potential for great savings on dressing costs and nursing time. It was a win-win for everyone that was involved, especially the patient. The nursing home made PUSH a part of their wound care protocol from there. Anyone who entered the facility that was a diabetic or had a high Braden risk assessment score was given the supplement. This was my very first study. I then took it into all the other facilities that I govern with my software. We were able to track the same results as well. So I knew that the product could have super potential in helping my community. I'd like to talk a minute about how PUSH, the collagen dipeptide, is a little bit very different from the liquid protein that most people are using today. I would like to take a minute to tell you about the use of PUSH in standard concentrate, products like ProStat, ProMod, ProSource, or even our own Global Health Liquicell. At Global Health, we developed a great tasting concentrated liquid protein called Liquicell. Our goal was to improve taste, to produce improved patient compliance, and to bolster outcomes. Liquicell has 16 grams of protein and 2.5 grams of added arginine in just 1 ounce of liquid. The product has been very successful, especially in the dialysis market and the wound care marketplace as well. My 65 nursing homes have been using Liquicell for years, but things changed, and for the better. I found the PUSH dipeptide product to be superior over my Liquicell. It is correct, I am competing with myself. Heal times are vastly better with PUSH. My goal has always been to find better solutions for my medical teams. Dietitians have been taught to increase protein, fluid, calories to promote healing. So PUSH, comprised of 5 grams of protein and concentrated amino acid, seems against their traditional thinking. Our product is a new science. A person would have to take 20 single servings of any concentrated protein supplement to ingest the amount of concentrated dipeptides in 1 package of PUSH. The concentrated dipeptides are the key to trigger fibroblast migration and enhance hyaluronic acid synthesis. Blaine will give you a better overview of this science in just a minute. So think outside the box and provide the most optimal environment for wound healing. We have seen heal times drop dramatically and stalled wound beds begin to heal. It has been the most important discovery in my 35 years in this business. It is a real difference maker. I'd like to show you one example before I turn it over to Blaine. Last week we had a rheumatologist come into our facility here. She had a mother that had fallen down. There was 2 severe wounds. One was a surgical site after a puncture wound from the fall. The other a contusion was the result of a fall. Her daughter, again, started photographing her wounds. She took PUSH twice daily in 2 to 3 ounces. Please see the end result. The surgical site was dated from 2/8 to 4/16, about 8 weeks to heal that particular wound. The nasty contusion heal time was slightly longer at about 3 months. The rheumatologist had told me that she thought that it was over for her mother. It would be very difficult for her to come back after this difficult fall. The woman was 83 years old. Both her daughter and her mother are very pleased with the outcomes and are still using PUSH today. Now, I will turn the webinar over to Blaine Hicks, who will review the science behind the product. Thank you.
Thanks, Al. Yeah, that was a great story. Appreciate it. And now, as Al said, my name is Blaine Hicks. I'm going to be explaining some of the science behind supplementing with the collagen dipeptides. Your body has a lot of collagen. On average, it makes up about 25% of your non-water weight. It is by far the predominant protein in skin, bones, ligaments, tendons, and cartilage. Every year we break down and lose around 7 pounds of our collagen, and our body manufactures back about the same amount. As we age, this balance becomes unfavorable, and we begin to lose more collagen than we're making. At age 25, we lose around 1.5% of our total collagen each year. Over time, this trend contributes to many of the physical conditions associated with aging. So if we want to prevent these changes, we need to find a way to slide the scale, the mass balance scale, back towards a positive situation. The story of PUSH starts in Asia, where collagen as a dietary supplement really began. In this market, skin health is an obsession. And when clinical research showed that there was a measurable benefit to consuming collagen, collagen for skincare began to catch on outside the circles of traditional therapies into mainstream consumer markets. In the early 2000s, this research focused mostly on beauty and anti-aging benefits. Collagen was shown to improve skin moisture, like Al said. It also improved elasticity and reduced fine lines and wrinkles and the prominence of sunspots. So Josai University, located near Tokyo, Japan, emerged as one of the leading research institutions performing the collagen research under clinically controlled conditions. Other leading research institutes included Kyoto University, which also contributed to the modern understanding of what collagen is doing. What they found was an apparent deficiency in collagen consumption, even when daily protein intake was being met. Other protein sources were not providing the collagen that was recommended for daily consumption. In fact, dietary sources were typically providing less than 2 grams of collagen per day. Supplementing collagen to make up the difference was the next logical step. So because Japan was the center for the collagen research, it also became the center for the most developed consumer market for the product. In 2008 and 2009, the demand in Japan for collagen dietary products was so great that producers could not supply sufficient quantities to meet the demand. In 2009, collagen ingredients were present in 29% of all new food products in Japan. Today, over 80% of the population in Japan claim they're aware of health benefits associated with consuming collagen. So the question I want to ask rhetorically is, why do other proteins not satisfy this? So if your protein requirements are being met, why is that not enough? Collagen is unique compared to other proteins. It's mostly made of 3 specific amino acids, also called peptides, which repeat heavily in a pattern, and they make a long string. The 3 amino acids are glycine, proline, and hydroxyproline, and the repeating pattern is typically glycine plus X and Y, where X and Y are usually the proline and hydroxyproline. One other unique thing about collagen is the hydroxyproline, which is not found in any other protein source. In 2005, researchers at Kyoto University reported that dietary collagen could also be absorbed as a dipeptide or paired in groups of glycine, proline, and hydroxyproline, and that these had diverse biological activities. This was important because many polypeptides cannot be absorbed into the bloodstream. They have to be broken down into individual amino acids to cross the barrier. The fact that dipeptides could cross from collagen was a clue to how they functioned. From among the dozen or so di and tripeptides that could make this crossing into the bloodstream, it was eventually found that PO and OG had the functional benefit. So that's our abbreviation. The PO stands for proline hydroxyproline, and the OG is our abbreviation for the second dipeptide, hydroxyproline glycine. So PO and OG are absorbed quickly. They spike to a maximum concentration in the bloodstream about an hour after consumption, and they maintain an elevated level in the bloodstream for about 4 hours. In another study, radio-labeled peptides were tracked after consumption in mice and were shown to accumulate in the skin and structural tissues, where they remain for about 96 hours after consumption. Other di-and-tripeptides are broken down quickly, sometimes in as little as 8 minutes after entering the bloodstream. So they can't affect, they can't stimulate changes like the PO and OG can. Once the PO and OG migrate to the skin, the structural tissues they stimulate change. They improve skin health by stimulating fibroblast migration, regulating cell proliferation, and enhancing hyaluronic acid synthesis through an upregulation in the genes. The stimulation is unique to PO and OG and easily demonstrated, and this effect is easily demonstrated in vitro using harvested fibroblasts and confirmed through dozens of human clinical studies showing improved health in the skin and other structural tissues. So that brings us to collagen for pressure ulcers. In 2013, research began to branch off from beauty and focus on other medical benefits. And it was discovered that in hairless mice that had been exposed to UV radiation, they had an improved barrier function to their skin when fed collagen before the exposure. Other studies in 2014 and 2015 by Josai University confirmed that other various benefits to damaged skin in mice, including an observed improvement in wound healing. This observation is the first inspiration towards pressure ulcer study in humans and the development of PUSH. So the human clinical trial for collagen treating pressure ulcers was published in Japan in 2015 and again in English in 2018. So the human study was a randomized, double-blind, placebo-controlled study and evaluated 120 patients over 16 weeks. It had 3 test groups: a placebo group, a standard collagen group, and a specialty collagen group with concentrated PO and OG. It reviewed how consuming collagen affected the healing times on stage 2 and stage 3 pressure ulcers. The efficacy was measured by statistical analysis of the patient's PUSH score, PSST scores, and measuring the total wound area. At 16 weeks, both the collagen groups had improved at a significantly better rate compared to the placebo group. The third group, which was given the concentrated PO and OG collagen, had improved significantly better than both the other 2 groups. Over 16 weeks, the placebo group saw a 21% improvement in the PUSH wound scores. Standard collagen saw a 46% improvement in the wound scores, and the PO and OG collagen group saw 72% improvement. This was a pretty striking contrast in heal times, considering that this is not a drug. It's not expensive. We're talking about 10 grams of a specific protein added to their diet twice a day. The study concluded that the study's conclusion stated that it might be possible to control the healing effects of collagen hydrolysates on pressure ulcers by altering their dipeptide content. In other words, by increasing PO and OG, you can improve the potency of collagen. It's important to repeat that just increasing a patient's protein intake by 10 grams won't have the same benefit. PO and OG are only found in collagen. Hydroxyproline is not significant in any other protein source. So why not use just a commodity collagen? The short answer is you can. The commodity collagen was shown in the study to improve healing times over traditional therapies, but it wasn't as good as the concentrated product. The natural content of PO and OG in commodity collagens is actually pretty low. It's less than 100 ppm, and in most cases that we've tested on the market, it's less than 10 ppm. This means that you must consume more to get the same benefit. The concentrated collagen was significantly better in the study because it has about 30 times the concentration of functional dipeptides, meaning that that similar benefits can be achieved by consuming much less. Adding 10 grams of collagen to coffee, juice, or water is barely noticed compared to a protein shake that's consumed like a meal. Good nutrition definitely plays an important role in wound healing, but pressure ulcers can be resistant to traditional therapies because nutrition alone does not produce the extracellular matrices which are key to tissue repair. Proline hydroxyproline and hydroxyproline glycine from PUSH will significantly reduce the healing times by upregulating key genes related to skin repair. These genes increase the rate of cell proliferation and hyaluronic acid production. Bottom line is that this product was designed to treat pressure ulcers easily and effectively based on 20 years of strong research and clinical studies. Since it's a protein, not a drug, it's safe and easy to implement. The real question is, why would you not use it?
Thank you, Blaine. Thank you for that explanation. I'd like to now continue with the overview of the product itself. Indications: where can PUSH be used? Pressure ulcers, deep tissue wounds, unstageable 3 and 4 wounds, surgical sites, skin tears, abrasions, venous stasis ulcers, bruising, diabetic wounds, pre and post surgery for patients, diabetes, patients with low Braden scale scores for high-risk people. Product usage, obviously, can be taken orally. You're going to mix the 7-gram serving, very small amount of powder, into 2 or 3 ounces of water. You can also put it through a G-tube if you need to. Administer it through the tube, through the water flush. Simply stir it, take your 60 cc syringe, and obviously put it through the G-tube. Our package shelf life is 2 years and is dated. Our canister is shelf stable for 6 months after opening. Our serving size advantage. I knew from being in my nursing homes and watching my nurses pour money down the sink because our residents would not consume 6, 8, 10, 12 ounces of liquid. So I wanted to make it very easy off the med card for the nurses to be able to give the product. Obviously, if you can't get the product into the patient, then you have no potential outcomes. Taste and flavor. I wanted to make it very light in texture, so we made it a very light pineapple and a very light mixed berry. If we didn't want it to coat the throat, like the Ensures or Boost or 2-Cal-HN, it's a pleasant scent. I took the flavors into the nursing homes. As I built the product, my nurses gave me feedback on how the patients accepted the product, and we settled on those particular flavors. Our packaging, available in 2 ways. Single serving packets, 30 to the box, 6 boxes to a case, or we have a bulk pack and a canister of 72 servings, very economically priced in the can. Talk about economically priced. Our product is about half the price of other arginine products that are out in the marketplace right now. Since we manufacture our own products here, we have the ability to control our cost and distribution. We buy all our ingredients directly from the manufacturers and blend and pack in our plant. So whether your patients are in a facility or living at home, our goal was to make it as affordable for everyone to get this particular product. Quality control. Our porcine is derived from USA FDA-governed farms. Everything is tested on outside national laboratories for micro and potency, governed by lot numbers and manufacturing date in case of any kind of a recall. How do you obtain our PUSH collagen? Nursing homes, hospitals, and wound clinics, you can either purchase directly from Global Health Products or one of our networks of distributors. If you have any concerns on who to buy it from, just call us. We'd be happy to help you and set that up. For people in home care, we have pharmacies as well. They can purchase the product from us and service the outpatient person maybe in the wound clinic. Patients can also visit our website. We have a Global Health shop You can buy the product. We'll ship it right to your home upon your order. Samples, literature, and clinical studies videos are available at www.globalhp.com. If anybody would like to conduct a patient trial, feel free to email me. I've probably given away about $100,000 of this product out into the community across the United States for people that have come to me with stalled wound beds. We have a fantastic overview from people's and customers telling us the great results that they have. With that, I'd like to thank you. I'd like to thank Blaine and everybody for coming on today and learning about our new supplement, PUSH. Thank you.
Alan, Blaine, thank you so much for the presentation. As mentioned,
Sure.
We're now opening up the floor to questions. If you have a question for Al or Blaine related to today's program or PUSH Collagen Dipeptide, please submit your question using the Q&A app found on your console. We'll try to get through as many as we can in the next few minutes. For our first question, Al, is PUSH reimbursed by insurance?
It is not reimbursed orally, but yes, it is reimbursed enterally. I know that in some states, orally, depending on the state you're in and the Medicaid laws within your state, it is sometimes covered, but generally I would say not orally, but from a Medicare standpoint, it could be paid for enterally.
Great. And Al, where can patients obtain PUSH?
That's a good question. The first place they can go is to our website. They can buy it there online with their charge cards. We can obviously ship it right to their homes. By the end of June, we are available at CVS pharmacies across the United States. You would just have to go to the pharmacy counter and tell the pharmacist that you would like to purchase PUSH, and they could get it in for you in the next couple of days. Or if you'd like to find out who your nearest distributor is, simply call us and we will set you in the right direction to get the product.
Great, thank you. Blaine, this next question is for you, and it's got a few parts to it.
Okay.
What is the documented absorption of this compound? What pathway via the gut is it absorbed? And what large studies support this as a supplement for improving wound care?
Okay, so starting with the absorption pathway, so this is absorbed the same way that typical proteins are. When protein is orally administered, it typically goes through a digestion process. Obviously, there's acid hydrolysis, and then different proteases, pepsin, pancreatic secretions. These digest it down to individual amino acids and dientripeptides. So the pathway that it goes through from the intestines into the blood would be the oleopeptide transporter PEPT1. That's a very standard transporter, and that is within the brush border membrane of the intestinal wall. The second question about the large-scale studies. To date, there's only been one human clinical study on wound treatment, but there's a lot of in vitro and in vivo in vitro studies and animal studies that support the human clinical trial.
Great, thank you. And Blaine, I have another question for you. How much collagen is recommended for daily consumption to maintain skin integrity and promote tissue building and aid with wound healing?
So the human clinical study that was done showing the significant benefit was done with two collagens. The first was what we would consider a commodity collagen that you would just buy off the shelf at a grocery store, collagen in a canister, and the second was the fortified version. Both were consumed at 10 grams twice a day, and then the concentrated version was shown to be significantly better than the commodity collagen. So I would say that the recommended dosage for wound treatment would be at least 10 grams twice a day of the concentrated collagen, the PUSH.
All right, thank you. That's all the time we have for today's webinar. Thank you for all of your questions. If your question was not answered during today's event, a Global Health Products representative will follow up with you separately. This is just a reminder that we have included a link to additional product resources under the document icon. Please be sure to review these resources at your convenience. You may also visit the Global Health Products page on woundsource.com for more information on this product. This webinar has been recorded and will be made available in full on demand after the program. Please look for our follow-up email that will alert you when the on-demand recording is available so that you can review any material you missed or simply go over the program again. Also, you will be redirected momentarily to a brief survey. We appreciate your participation in this questionnaire as you leave the program. I would like to extend a warm thank you to Global Health Products for sponsoring today's program. On behalf of Al Salura and Blaine Hicks, as well as the teams at WoundSource and Global Health Products, thank you for joining us and for taking the time to view this webinar. Have a wonderful day.